Hello, everyone, and welcome to this edition of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettus, joined by my good friend and colleague,
Dr. Steve Edelman.
So Steve and I are both endocrinologists, University of California, San Diego, both living with type 1 diabetes since we were 15 years old. And Steve founded this wonderful organization, Taking Control of Your Diabetes, TCOAD, exactly 30 years ago to the minute today.
Thank you, Jeremy.
Congratulations, Steve. So this is a two-part podcast series. We just wrapped recording our first part, which was on the top 10 tips for people living with type 1 diabetes. And guess what? Now we're going to do the top 10 tips for
type 2 diabetes.
Yeah. So I was in charge of the type 1 podcast. I came up with my 10 tips. Steve had never seen them before. Now Steve is going to return the favor. He came up with his top 10 tips I've not seen before. So we can go through those and get my commentary as we go.
Okay. We ready?
Yeah.
All right. Just some opening comments.
Great.
Type 2 diabetes is extremely common. It's also a kind of a complex condition, more than type 1, and it runs in the family very strongly from generation to generation. The other thing is you have to realize that there are 40 million Americans living with type 2 diabetes, and another 80 million have pre-diabetes, meaning that every year a certain number of those go into type 2. So you're not alone.
Yeah. And by, just comparison, there's about 3 million type 1s. So a lot more type 2s, but type 1s are still special.
Yeah. And here's the thing. It's important for everyone to know before I get into the 10 tips that type 2 diabetes is a controllable disease. It's manageable. And I always like this quote from Sir William Osler. The way to live a long and healthy life is to develop a chronic disease and take care of it. So there's no question that when I have patients come in newly diagnosed type 2, they might be overweight, they might have high blood pressure, abnormal cholesterol, and then they get diagnosed. And then they have a good doctor. They might have a multidisciplinary approach. They start working on their diet, start working on the other abnormalities, and that can make them live longer than if they were not diagnosed.
I was going to say, it can be an opportunity, to be honest. To get on these medications, people, you see them lose weight, they change their life, literally. So, and it's actually fun as a provider when those patients come in, like you described, starting them on some of these medications, seeing these changes, seeing all these numbers improve. It's really rewarding.
Yeah, absolutely. We can make such a big impact. Okay. They're not in these are not in any particular order, but I feel very strongly, being someone of education and knowledge, is that you should have an understanding of what's going on in your body with type 2. So the first thing I'll say is it's not like type 1. You do have insulin around. You may not have enough.
So tip 1 is get educated.
It's knowing about the, ready for this, pathophysiology, the causes of type 2 diabetes.
What is type 2 diabetes? What's affecting my body? What's going on in my body?
Thank you.
Yeah. Tip 1. There it is.
Okay, basically, you have insulin, it doesn't work well, or you don't have enough. The other important thing to know is that people with type 2 diabetes have a thing called metabolic syndrome. And that's a group of cardiovascular risk factors that can lead to other issues like heart disease, liver disease, kidney disease. Now, these metabolic syndrome includes insulin resistance, high cholesterol, hypertension, obesity, and that's basically the baseline of the metabolic syndrome. Now, it may not be your fault because people with type 2 have central obesity. It runs in the genes, and it's not like the type of fat that people get when they just overeat for years and years. And that's something that's very frustrating for a lot of people with diabetes. They say, I can't lose this weight in my abdominal area. That's part of the metabolic syndrome. Now, as we'll learn as we go through, it sounds scary, and to start off with all these abnormalities, they're all treatable. But it's important that everyone know that you're not going to be just treating the glucose levels. You'll be treating the lipid levels, the blood pressure, and you'll be fighting weight.
These things all run together.
Yeah.
If you have type 2 diabetes, there's a good chance you are overweight or obese, so you're dealing with high blood pressure, cholesterol. So it's very common. That's kind of where we start. And then, the good news is these things, I hate to use the word easily, but they're very Treatable.
They are treatable. And once you get these under control, it's much easier to maintain than trying to get to goal. Now, the second one, Jeremy, is a little bit like the one you mentioned in the Type 1 podcast, understanding the numbers that matter. What are your goals?
Got it.
So
I think that actually was my second tip. Did you cheat? Did you look at mine?
No, I didn't. I
Okay,
didn't.
know your goals. Number 2. I like giving labels.
Okay, the first one is A1C.
Okay.
What should someone with type 2 diabetes shoot for with their A1C?
Generally less than 7. Lucky number 7.
Yeah. And this is a great opportunity to say that when you look at the lab slip, you know, some guy in the lab puts down the normal range, less than 5.7. Do not think you need to be less than 5.7. That probably pertains to all the type 1s out there as well. They should have a separate list that says goals for people with diabetes. Less than 7, you may not all be less than 7. Some of you may be higher, and I always love when you say going from 10 to 11, going from 11 to 10 helps, 10 to 9. Always be etching towards your particular goal.
Yeah, it's not binary. You know, if you're less than 7, you're good. If you're above 7, you're bad. Every little, notch lower towards 7 matters a lot, actually.
Okay, what about pre-meal blood sugar goals?
I would say probably less than 140.
That's good. I think that's a good goal.
I mean, that's different than fasting, which I would say even lower. Yeah.
Okay. And what about 2 hours after eating? A lot of people like looking at their numbers after eating.
Less than 200?
Yeah, I think that's a good goal. Theoretically, less than 180, but I think these are good goals to start from because they're not too stringent. And when we get to the lipid levels, I'll just go through them quickly. I don't look at total cholesterol. You've heard me say that before because the total cholesterol can be misleading, but I do look at LDL, less than 70. And if you have heart disease, less than 55. And you always say if most people with diabetes will need some type of LDL lowering drug. We got lots of choices today too. Were you going to say something?
I was going to say, I don't know anybody that's just naturally walking around with an LDL less than 70. It's really hard to do. This is largely genetic. So if you want to get your numbers there, and I always tell people too, I don't care if you ate grass all day long. You can't make that much of a dent in your cholesterol from just dietary interventions. And if you want to get to where you need to be, we're not pushing medications, but you're going to need to take some kind of medication to get to that goal.
Yeah, and you should try not to fight that concept of taking a lot of medications because I've always said type 2 diabetes is a polypharmacy condition. Now, the other thing that people with type 2 diabetes have when you look at the cholesterol levels, the lipid panel, they have high triglycerides, which is a form of fat, and we try to keep that at least less than 200, but even getting up to 300-400 is not dangerous. Once you get above 500, you need to really have a serious conversation with your doctor, but also the HDL. That's the good cholesterol. So people, unfortunately, they are related to each other. High triglycerides, low HDL. And what you try to do is you improve your glucose control. You may need some cholesterol, triglyceride lowering medications. When you lower your triglycerides, the HDL goes up. And the HDL, we really don't have much control over, but we try to get it 40, 50 range. And once again, triglycerides less than 200. And that's something that type 1s don't have to deal with.
Yeah. And I would say of all those, I would say if I had to pick, the LDL being the one that we can intervene on the most, maybe the most important, the number for you to keep in mind. You want to keep that less than 70. And this is all still bullet points under tip 2?
Yeah, we're on tip 3 now.
Oh, okay. So tip 2 is know your numbers, your A1C, your blood glucose, and your cholesterol, and your blood pressure. We want to keep less than 130 over 80. And the same kind of comments that these are generally oral medications, easy to treat. So make sure you know that. We say ABCs, A1C, blood pressure, cholesterol. Know those at every visit. Tip 3?
Wow. Tip 3, we don't have to spend too much time on, but find a knowledgeable care team. Now, in the olden days, people went to a real diabetes clinic. There was the primary care doctor, the endocrinologist was nearby. You had the dietitian, the exercise physiologist, and a diabetes educator, and perhaps even a touchy-feely person like Dr. Polonsky dealing with the emotional and behavioral issues of living with diabetes. And we don't have those anymore, but you can figure out what specialists you need the most and then go after the best person. Talk to friends, talk to the local diabetes organization. I actually talk to some of the representatives that sell diabetes drugs and devices and say, hey, because they call on all the doctors in town.
So when should somebody with type 2 see an endocrinologist?
Yeah, that's a great question, but I'm supposed to be leading this. No. I'm kidding. That's a great question. If you have newly diagnosed type 2, your A1C's at goal, your weight's at goal, and you're on one of the basic medications like metformin, you may not need to see an endocrinologist more than, I'd say, once a year, because there's so many advances going on in type 2. All the GLP-1s, which we're going to get to in one of the tips, they have so many other advantages. Primary care doctors, God bless them, but they can't keep up with all the advances in diabetes.
Yeah. Okay.
What were you going to say?
No, I was, usually, to be honest, like we talk about, there's a shortage of endocrinologists, and not everybody with type 2 can get in to see somebody. So honestly, Steve, the people with type 2 that we see in our clinic tend to be people that have had it for a longer time, they on insulin or maybe a more complicated regimen. So certainly then, I really wish I could see every newly diagnosed type 2, because I think that's actually the most important time to intervene and get people to take this seriously, take their medications, get their blood sugars under control, and keep them there. Rather than, we'll start one medication, wait for you to get out of control, then try to intervene. I think being more aggressive early is really important.
Yeah, we call that treat to target for all you listeners. All right, tip number 4. This relates to diet. You don't have to eat cardboard. You can eat the foods you like, and there's a couple basic rules. You eat the foods you like in moderation. Portion control is probably the most important thing you could do, because, you don't want to, you get type 2 when you're a little bit older and you're set in your ways of what you like to eat. And I like to tell people 2 to 3 well-balanced meals a day, avoiding concentrated carbohydrates and fats most of the time. So it comes down to just eating the foods you like, but not restricting yourself so much that you hate having diabetes.
Mm-hmm. And then, meeting a good dietitian, I would say, along those lines, because there's little substitutions that you can make. Everybody likes to snack, but what's a good low-calorie, low-carb snack? The one thing that you really have to pay attention to is what you're drinking. I'm not talking about alcohol, although alcohol is important. But if you're throwing down a lot of juice and soda, that's a lot of empty calories. Maybe switching over to diet soda or, Gatorade Zero, these kinds of things. These little substitutions, you really don't have to suffer, because you can find usually something that you like, and you can cut out a lot of calories and a lot of carbs that way.
Well, you covered the area I was about to cover, exactly that. It's not just
Is this a new tip? Is this still part of the same tip?
Yes. Well, it's the same thing.
Okay.
It's food, eating, drinking.
So this tip is food.
Yes.
Okay.
I said diet.
Okay.
All right. You're right, Jeremy. We have the choices now of non-caloric beverages are tremendous. And I love the Mio, the flavored drops. There's Bai. You mentioned Gatorade Zero. I like Powerade Zero now.
I do too. I like it better. I like Gatorade, straight up Gatorade better than Powerade, but I like Powerade Zero better than Gatorade Zero.
Yeah, and for people that say to me, they say, "Oh, I drink regular Coke because I don't like the taste of diet." That drives me nuts. And I always try to convert people with diet root beer. That's one that tastes exactly like
Diet
regular
Dr.
root
Pepper
beer.
is really good too.
Is that right?
Yeah. Coke Zero.
I've never had the regular Dr. Pepper, so I wouldn't know. So anyway, the bottom line is you're going to learn to improve your eating habits slowly. And it comes down to common sense. Don't fall for all the magic diet pills out there that you see on television or online. It just comes down to eating well-balanced meals 2 to 3 times a day, limiting the portion size.
Mm-hmm.
Okay. 5, exercise. And I know you know this quote. If you don't find time for exercise, you're going to have to find time for disease. God bless Larry Verity, exercise physiologist that spoke at many of our original TCOIDs. And with type 2, we're just assuming folks are maybe a little bit older, have problems with weight, which gives you problems with your joints. You have to start slow.
Yeah.
Like walk for 10 minutes even, and just slowly increase the amount the distance. You don't have to join Jeremy's fancy gym with all these people in spandex.
Okay. I go to the YMCA. Steve goes to LA Fitness. So you got the fancy gym. I don't. But obviously I agree with this, Steve, but I wouldn't even call it exercise, because sometimes that can be off-putting to people. They immediately imagine, playing basketball and kayaking and, these things that they've never done before. So it's moving your body. And it's definitely, I know you'll get into the goals, but things like walking, stretching, all these things can make huge improvements. Even if you don't change your weight, you can change your distribution of fat, muscle, your insulin sensitivity, all these things. So sorry, I kind of cut you off there.
No, you didn't. I'm adding on to that. Just walking in a pool with a lot of resistance. Mm-hmm. And I know you do that naked, don't you?
Oh, yeah, all the time, twice a day.
What about dancing around your living room?
Naked.
Yep, there you go. And, even gardening, I know that you're growing certain things that are allowed to be grown in California back there. Yep. So any type of activity. Oh, my God, that's double whammy. The bottom line, you're right, Jeremy. I use the word exercise. It's old school, but you want to move your body. You want to get your heart rate up a little bit. The one thing I want to...
Well, let me just say, the official recommendation is 30 minutes a day, at least 5 days a week. And that, when you put it in that terms is, it's obtainable, and it's not, like going to the gym and putting on spandex. It's something sustainable. Keep your heart rate up a little bit. Could be walking around the block. It could be in these other activities you enjoy. But that it becomes doable. But maybe you start with 1 day a week and you work your way up there.
Just walking to your mailbox, even. Yeah. The one thing I want to say is that, we don't want to motivate you so much that you haven't exercised in 5 years and tomorrow you do something extensive. There's a lot of underlying heart conditions that you don't know unless you stress yourself. So if you're one of those couch potatoes and now you're really going to get out there and move your body around, it's probably a good idea to just mention that to your doctor, and they may even get a stress test on you, some test of your heart, and that's a win-win. Mm-hmm. If you have a problem, they'll address it. If you don't, then they give you the green light to exercise. Okay, this one I know you're going to love.
Yep. I hope it has a really long title.
The most important type 2 diabetes medications we have, GLP-1 receptor agonists and SGLT2 inhibitors. Which one you want to cover first?
Are these different tips?
Yeah, they're tips.
Okay. All right. It's unclear what tip we're on.
Let's start with number 6.
Okay. GLP-1s. These are drugs like Ozempic, Mounjaro, Trulicity, et cetera. Super important, once weekly injections. Game changer medications, not just for diabetes, but I would say health. Just changed the world in terms of what these drugs can do and the positives that keep coming out about these drugs.
Yeah, well, you know what? They first came out, it was to glucose control, and then they lost a tremendous amount of weight. Then came all the other quote unquote indications, meaning other conditions that they have been proven to treat. And we'll talk about obstructive sleep apnea, kidney function, fatty liver. Did I miss any?
No, it's just that usually like when a drug comes out to the market, when it goes from a couple thousand people in a clinical trial to 1 million people using it, it's common for something negative to come out. Oh gosh, we didn't know that this drug, adversely affected the liver. This is the opposite with GLP-1s. We started with, hey, it lowers blood sugars a little bit. That's great. And now, gosh, it helps reduce heart disease, kidney disease. You said obstructive, all these things. So people say, are these drugs safe? They've been around since 2005. We've had them for over 20 years now, and the positive benefits keep adding up. So I have a number of type 1 friends and patients that would kill to be on these medications. So that's what I'm saying. It's a real opportunity here. If you have type 2 diabetes, these are indicated and can be, change your life, help you live longer. I mean, that's wild.
Yeah. And the listeners and viewers should know that the American Diabetes Association gives doctors directions of which drug to use first, which drugs to use second. And they clearly say, lifestyle plus metformin first. But they quickly go to the next level, especially if you have any degree of heart disease or kidney disease. They say right to a GLP-1 receptor agonist or an SGLT2 inhibitor, which we'll cover next.
Yeah, I mean, I would say, if I had it my way, if you have type 2 diabetes, every single person should be on a GLP-1 plus one of these SGLT2 SGLT2 inhibitors, which we'll talk about next. They're fantastic medications with a lot of benefits. And I think, again, I'm a big believer in being kind of aggressive early. So that's my 2 cents.
That sounds like a Burger King commercial.
Yeah.
If I had it my way. You know what? We're not too far from that. As soon as these drugs become a little less expensive, more competition out there, I see that happening. And I think you should be treating pre-diabetes earlier too.
Yeah.
Now, the SGLT2 class, that's Farxiga and Jardiance and a drug called Impifa and Invokana. These drugs were the same thing. They came out. They were supposed to just lower glucose, and they quickly learned that they also reduce one of the main reasons why people with type 2 and type 1 diabetes pass away is from congestive heart failure, a form of heart disease, and they are super effective. Then they did a study looking at kidney disease, and so they have been shown clearly to reduce the progression of chronic kidney disease due to diabetes. So both these classes...
And let me just add that these drugs, Farxiga, Jardiance, once a day pills, these GLP-1s, once a week injection. So if you get on a drug, you take a small pill, honestly, they're small, once a day, and a once a week injection, you can control, I would argue, up to 80% of people with diabetes right there.
Yeah, and I think the earlier you start them, the better. And I think for everyone listening, if you're not on one of these two drugs, you should really think about why you're not on them. And if you don't really know the reason, you should have a discussion with your healthcare professional.
Absolutely.
Okay.
So, Steve, such good points. And I got to say, this, I got to run because I got a kiddo I got to pick up. But I'm confident that you can take our listeners through the remainder of your list. And I'm going to listen. And if I have any comments, I'll talk about it on the next podcast.
Okay.
So best of luck. Viewers, please don't tune off just because I'm leaving. I know it's really, really tempting, but Steve's gonna take it from here.
All right. Drive carefully. All right. We're going to go to tip number 7. And this is all about continuous glucose monitoring. I like to call it the crystal ball of blood sugars. And it's your own personal laboratory in the palm of your hand. Now, I know what some of you are thinking. What if I'm not on insulin? Will I be eligible for it? Well, no, you won't be eligible for it, but they do have them over the counter now. Dexcom has the Stella, Libre has the Rio, and I'm not saying buy 2 a month for the rest of your life. It's such a great way to see your blood sugars every 5 minutes in relation to what you eat, how much you eat, the type of exercise, the intensity of the exercise. And a lot of times people have an eye-opening experience. And they say, oh my gosh, I never realized I bumped up to 275 after eating meals. Or they may be on a pill called a sulfonylurea that may cause you to get too low. And you don't even realize that you're getting low at night. So I would say everybody should have access to a CGM. And if you're not eligible, I would do anything you can to go out and buy one over the counter and just experiment and see how you do. And it'll change the way you take care of your diabetes and lifestyle management. Now, if you're on insulin, it's invaluable. In fact, all you have to be on is 1 shot a day to be eligible to be approved for a CGM. Even if you're on basal insulin, even if you're just taking 1 shot of fast-acting a day with dinner, you are eligible. And it'll help you not only adjust your insulin, but titrate the insulin. And because of the alerts and alarms, it'll warn you when you get too high or before you get too high. And it'll also warn you before you get dangerously low. So you'll get a number, you'll get a trend arrow, will tell you which direction your blood sugar is going. And I can't tell you how that has changed so many of my patients' diabetes control, and I think overall satisfaction with living with diabetes. In fact, they've done tons of studies looking at people with type 2 on CGM, and they all seem to do much better. And lastly, we talk about these hybrid closed-loop systems where the pump communicates with the CGM and automatically gives insulin to keep your blood sugars in a tight range. Well, they're used in type 2 now to a very great extent. So they're the backbone of these systems as well. Okay, tip number 8. This is more of a Jeremy touchy-feely. Get the support and find your people. What does that mean? I started off by saying that type 2 diabetes is very common. There's almost 40 million people in the United States compared to 3 million with type 1. And I think it's so nice to have a diabuddy or be in a group with other type 2s. Don't let any type 1s in there. They'll mess it up, because you guys are a special breed. You have a certain type of diabetes. You can do certain things that type 1s don't do, like take some of these medications. And it's a lifestyle. It's differences in lifestyle as well, because of the relationship to weight and all the different cardiovascular abnormalities. So, find a local group in your area, find a group online, and we actually have a TCOID group for people with type 2 diabetes, and at least you can start there. And if you're living isolated, no one with type 2, it's tough. And I know there's a lot of social stigma out there with type 2 diabetes as well, because everyone thinks you just ate yourself into getting diabetes. Okay, let's talk about the diabetes warranty program. This is basically like the diabetes warranty program on your car. You get your car serviced and evaluated on a monthly basis, or I should say on a regular scheduled basis, not monthly. You'll go broke. And supposedly, your car will run better and last longer. It's the same with our bodies. So what are the categories? Let's just go through them. Eyes. Get a yearly dilated eye exam from an ophthalmologist who is familiar with diabetic eye disease. That's it right there. And the reason why you have to do that, because there's no symptoms of diabetic eye disease in the early stages. Any condition that doesn't have symptoms, you have to screen on a regular basis. If eye disease caused pain, you wouldn't need a screening program. As soon as your eye hurt, you'd go to the eye doctor. What about kidneys? That's the second one. Get a yearly test of your kidneys. We talk about the estimated glomerular filtration rate, blah, 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 EGFR, and the urine microalbumin to creatinine ratio. Those are the two most important. We got lots of videos on our website about that. And these are the tests that you want to get done early, because when they start to become abnormal, that's when you want to jump on it and get the appropriate therapy. Once again, there's no symptoms of early diabetic kidney disease. What's the third? Third is nerves. Well, you get problems with your peripheral nerves. You get numbness, tingling, and your doctor can do a simple test on you when you go to the visit called the 10-gram monofilament test, and they can pick up diabetic neuropathy much earlier before you develop symptoms. So that's a test that you should get from your healthcare professional once a year. Okay, next is heart disease. That is such an important area for a diabetes warranty program. We've already covered some of the ABCs of protecting your heart. A1C and aspirin, 2 A's. B is blood pressure. C is cholesterol. D is drugs like GLP-1s and SGLT2s. And what is E? So it's A, B, C, D, E now. E is evaluations of your heart. Everyone should be getting at baseline, a stress test. Then you can get an exercise stress test where you get on a treadmill and they measure your heart rate. Then you can do an echo stress test where they look at the wall motion of your heart before and after getting on the treadmill. And then they have other things like the cardiac CT and the cardiac echo. So it's important to talk to your doctor and say, hey, do I need any evaluation of my heart? And I can tell you that these tests are under-ordered, and people with type 2 are prone to getting heart problems, and it's so great to pick them up earlier. Okay, the last one. Ask questions about diabetes and learn all that you can about type 2 diabetes. Knowledge is power. And I think our website at TCOID, we have a type 2 video vault, but even on our homepage, we have a lot of the most recent videos that we have done. We've done them on the diabetes warranty program, on fatty liver, on the cardiorenal syndrome, all these conditions that go along with having the metabolic syndrome. And remember, if you have type 2 diabetes, you have the metabolic syndrome. But once again, all the different aspects of the metabolic syndrome can be totally controlled. So I'm going to finish with 3 statements that I used to say from the beginning of our first TCOID conference in 1995, bringing back great memories. You have the main responsibility for taking control of your diabetes. It's not your wife's, not your husband's, not your son's, not your doctor's. You have the main responsibility. So you have to be your own best advocate. Know what you need and go out and get it. And the last one is be smart and be persistent. So with that, take control of your diabetes. You owe it to yourself and your family.